because in fact, the highest age recorded so far is around 7 to 9 years old. They are still breastfeeding. I am Dr. Catherine Onghanseng. I'm a pediatrician and an internationally board-certified lactation consultant, and I work at Makati Medical Center. Breast milk remains to be the best source of nutrition for babies due to its many benefits. A simple mnemonic to remember these benefits is ABCD. A is for antibodies. Antibodies are protective proteins produced by the immune system in response to the presence of a foreign substance, such as infections. When either the mother or her baby is sick, the mother's body produces antibodies that she can transfer to her baby through her breast milk to protect them from illnesses. And B is for bonding. Breastfeeding helps create intimacy and bonding between the mom and baby. This connection can provide beneficial psychological effects like lowering stress and increasing feelings of calm for both the mother and baby. C is for complete nutrition. Breast milk contains 90% water and 10% nutrients, which is the right amount of all the necessary nutrients to grow healthy during the first 6 months of life. So, ND is for development. Many studies have shown that breastfeeding has been associated with improved IQ and EQ scores. These are due to the fatty acids contained in breast milk essential for brain development during infancy and higher oxytocin, or the love hormone levels, that reduce stress and avoidance behaviors. We generally advise according to the recommendations of the World Health Organization, wherein they recommend exclusive breastfeeding for the first 6 months of life. And from the age of 6 months, children should begin eating safe and adequate complementary foods while continuing to breastfeed for up to 2 years of age or beyond. So even after 2 years old, breastfeeding can continue until the mother and the baby are ready to wean together. Actually, after 2 years old, so breastfeeding's function is more of emotional, a bonding experience. So the benefits is no longer nutritional, but the immunity, everything else. So the limit is actually something that is between the mother and the child. It is a family decision because in fact, the highest age recorded so far is around 7 to 9 years old. They are still breastfeeding. So it's more of a cultural thing. But if you ask for medical benefits or medical recommendations, then as a lactation consultant, I would tell you to keep at it as long as possible, as long as it's okay with mommy, baby, and the entire family. So breast milk is dynamic. This makes breast milk irreplaceable because breast milk changes as the baby grows. During the first few days, the mother produces colostrum, which is the milk that is thick and yellow and smaller in volume, but it is more concentrated in the things that the newborn needs, such as creating a thriving immune system so it is full of antibodies, good bacteria, and other protective cells. Towards the end of the first week, milk changes into transitional milk. The volume increases and becomes creamier due to higher fat and lactose content to help with baby's development. After around 4 weeks, it's pure milk, which contains high amounts of proteins, lactose, and other vitamins and minerals to nourish the baby. Continuing breastfeeding during a child's toddler years will give the milk a less amount but higher antibodies and higher fat content for immunity and brain development. This emphasizes the importance of breastfeeding your child for as long as possible. Breastfeeding follows the law of supply and demand. That means when the demand is high, meaning when you are breastfeeding frequently and draining the breast after each feeding, the factory, which is mommy's body, will produce more milk. So it means that the best recommendation actually to help boost milk supply is to nurse your baby often. So nurse around every 2 hours during the day and every 3 to 4 hours during the night. That would fall at around at least 8 to 16 times a day. If the baby is not nursing well, using a good quality double electric breast pump to increase milk production can actually help. Pumping after breastfeeding signals the body to produce more milk. Also, it is very important to make sure that the baby is positioned and latched correctly so that the baby is able to get all of the milk out of mommy's breasts. So another thing is they should not limit the nursing time. They should nurse the baby at least 15 minutes each breast, and if the baby falls asleep after one breast, try to wake him up and offer the second breast. So offering both breasts at each feeding is very helpful as well. Other techniques that we advise include breast massage, relaxation techniques to reduce stress, skin-to-skin contact or kangaroo care, and taking care of themselves, meaning eating and drinking well. So food include eating natural milk-boosting foods such as whole grains, especially oatmeal, dark leafy greens like spinach, broccoli, garlic, chickpeas, almonds, ginger, and spices like anise and turmeric, and avoid certain foods like sage, parsley, and peppermint, and definitely minimize or avoid smoking and alcohol intake. And finally, of course, is to consult their doctor or lactation consultant to determine the possible reasons why their milk supply is low or they're having challenges to help improve it. This includes the doctor can actually recommend or prescribe certain medications which can help boost their milk supply. When we give infant formula or another alternative form of supplementation along with breastfeeding, that is called mixed feeding. Although exclusive breastfeeding for the first 6 months is the ideal start for a baby, there are really reasons why mixed feeding can be considered, and this include issues or challenges with breastfeeding, low breast milk supply, and baby's failure to gain weight. So some breastfeeding challenges include severely sore, cracked, or bleeding nipples, breast infection or mastitis and breast abscess, inverted or flat nipples from the mommy, a tongue tie on the baby or a cleft palate, and if the mommy has to return to work when expressing milk is not possible. Sometimes, they may have a low milk supply, causing the baby to gain weight poorly. So, when the pediatrician sees signs that the baby is not having adequate intake, this include lower scores in their growth chart, or number 2, the baby is not meeting their minimum number of output per day, which includes their bowel movement and urine output. The baby appears very thin, less active, less vigorous, and keeps falling at the breast. Those are signs that maybe the pediatrician can start offering the mother an alternative to top up with breastfeeding, which is usually an infant formula. So, however, regular mixed feeding might make it more difficult to keep breastfeeding because it can interfere with keeping up a good supply of breast milk. So, if a mommy or a family is thinking about supplementing with infant formula, it is very important to first talk to their pediatrician or doctor about how to protect and boost their milk supply and what and how to give infant formula to their baby safely. So this remains to be a family decision as well that can be considered provided that the option recommended is acceptable, feasible, affordable for the family, sustainable, and safe for the baby. Sometimes breastfeeding doesn't go as expected. So, in fact, the UNICEF has reported that 8 out of 10 moms stop breastfeeding before they want to due to challenges that they have encountered. So, what these numbers tell you is that you are not alone. For breastfeeding to work, you need someone to turn to who believes it's important and believes that you can do it. And that means finding a qualified, informed breastfeeding supporter such as a lactation consultant or a breastfeeding support group. We can help you explore what's happening with breastfeeding in order to find workable solutions. So it's very important to find someone who can offer you their expertise and knowledge, and who will look at the mother and the baby as a unit. So the first rule always is to feed the baby. So finding the right support who can help your family achieve your breastfeeding goals or even make new ones while making sure that the baby is happy and healthy is our top priority. And for those mommies who are currently struggling to make breastfeeding work right now, remember that you are doing an amazing job. Remember to ask for help, and more importantly, be kind to yourself and celebrate your successes and find pride and peace in your achievements as a mother.